Welcome back to the Mindful Path, where we explore the intersection of mental health, psychology, and evidence-based healing practices. Our mission is to provide insight into mental well-being and practical approaches to healing. Today, we're diving deep into the psychological and neurobiological underpinnings of PTSD, as well as the most effective treatments available. A particular therapy we'll focus on is cue-centered therapy, an emerging evidence-based treatment that has shown promise in alleviating PTSD symptoms. Post-traumatic stress disorder, or PTSD, is a mental health condition triggered by experiencing or witnessing a traumatic event. Symptoms include intrusive thoughts, hyperarousal, avoidance behaviors, and emotional numbness. Research indicates that PTSD affects key brain regions involved in fear response and memory processing, particularly the amygdala, hippocampus, and prefrontal cortex. The overactivation of the amygdala contributes to heightened fear responses, while reduced activity in the prefrontal cortex impairs emotional regulation. Simultaneously, the hippocampus, responsible for distinguishing past from present threats, can shrink in individuals with PTSD, leading to persistent flashbacks and heightened stress reactivity. There are several evidence-based treatments for PTSD, including cognitive behavioral therapy, CBT, eye movement desensitization and reprocessing, EMDR, and exposure therapy. These therapies aim to reprocess traumatic memories, reduce hyperarousal, and increase adaptive coping strategies. However, today we want to highlight a particularly promising approach: cue-centered therapy. Cue-centered therapy is a structured therapeutic approach that integrates mindfulness, neuroplasticity, and targeted trauma reprocessing. This therapy is grounded in principles of quantum cognition, suggesting that thought patterns and memory encoding can be altered by shifting cognitive states. Recent research indicates that cue-centered therapy helps individuals reframe traumatic experiences, reducing distressing symptoms while promoting emotional resilience. By engaging the brain's neuroplastic capabilities, cue-centered therapy fosters the development of healthier neural connections, ultimately allowing for improved emotional regulation and cognitive flexibility. Cue-centered therapy consists of several core components, including mindfulness training, enhances present moment awareness and reduces physiological stress responses. Cognitive reprocessing encourages individuals to reconstruct traumatic memories in a way that decreases emotional distress. Neuroplasticity activation utilizes guided exercises to promote adaptive neural pathways and improve emotional regulation. By implementing these techniques, individuals with PTSD can gain a sense of empowerment over their trauma, gradually reducing the impact of distressing memories and reactions. PTSD is a complex condition, but with the right interventions, healing is possible. Cue-centered therapy offers a promising path toward recovery, utilizing neuroplasticity and mindfulness to create meaningful change. If this discussion resonated with you, we encourage you to explore these therapeutic approaches further. Thank you for joining us on the Mindful Path. Don't forget to comment, like, subscribe, and share. Until next time, stay mindful and stay well.